Mesothelioma is an aggressive form of cancer that develops from the mesothelium, which is a protective lining that covers most of the body's internal organs. This includes the pleura, the lining of the lungs, peritoneum, the lining of the abdominal cavity, pericardium, the lining around the heart, and tunica vaginalis, the lining around the testes. Most cases of mesothelioma are caused by exposure to asbestos, a fibrous mineral that was commonly used in many industries for insulation and as a fire retardant. People diagnosed with mesothelioma and their families often face significant medical, physical, emotional, social, and financial challenges. Due to the aggressive nature of the disease and lack of effective treatments, the prognosis for mesothelioma patients is generally poor. Here are some of the most common challenges. Physical challenges. Mesothelioma causes tumors and fluid buildup in the chest or abdomen, which can lead to breathing problems, pain, fatigue, and weight loss for patients. Common symptoms include shortness of breath, chest wall pain, and swelling of the abdomen. This makes even simple activities like walking or climbing stairs very difficult. Patients often need multiple invasive surgeries, which carry risks of complications and extended recovery times. Surgeries for mesothelioma commonly include extrapleural pneumonectomy, removal of a lung and the lining around the heart and lung, pleurectomy, decortication, removal of the lining of the lung and chest wall, or debulking surgery, removal of tumors. These are major operations that are highly taxing on the body. Chemotherapy and radiation are also commonly used to treat mesothelioma. However, these aggressive treatments often cause additional side effects like nausea, vomiting, diarrhea, fatigue, mouth sores, hair loss, low blood cell counts which raise risks of infection, and more. Managing treatment side effects can be physically draining. Later stages of mesothelioma, when cancer has spread or recurred, often involve intensive pain management to address chest wall pain, nerve pain, muscle pain, and more severe uncontrollable symptoms. Not all pain can be controlled effectively. Patients unfortunately face a poor prognosis where advanced mesothelioma is generally not curable. This realization and living with a terminal illness takes a significant physical and emotional toll over time. Emotional challenges. Receiving a diagnosis of mesothelioma, which is usually later stage in terminal in nature, can cause shock, denial, anger, fear, anxiety, depression, and grieving the loss of future dreams and plans. Adjusting to a new reality and short expected lifespan is very psychologically difficult. Physical side effects, disfigurement from surgeries, and deterioration of health can damage body image and self-esteem over time for patients. Watching these changes take place is also hard for family members to cope with emotionally. Family members experience huge levels of stress, sadness, caregiving burden, and feelings of helplessness watching their loved ones suffer without being able to cure the disease or take away all the physical and emotional pain. Patients and family members may feel stigma or embarrassment about the disease since it is strongly linked to asbestos exposure. Historical exposures in the workplace may evoke memories of past working conditions and employers. Towards the end of life, dealing with advanced symptoms, talking about death and dying, completing final affairs, and processing intense grief over impending loss creates tremendous emotional turmoil and psychological distress for patients and families alike. Counseling support helps but does not take away the suffering fully. Social challenges. Physical symptoms like shortness of breath, abdominal pain, and swelling interfere with activities of daily living, ability to work, drive, travel, and enjoy hobbies and social interactions. This social isolation negatively impacts quality of life. Caregiving responsibilities are often shouldered primarily by family members, which consumes much of their time and focus. This disrupts their own work, education, and social life balance as well in supporting their loved one. Mesothelioma patients may need to stop working much earlier than planned, which can damage careers, cost income support, retirement savings, and financial security long term. This dependence on others is difficult for independent patients. Hospital appointments, treatments, procedures and surgeries require huge time commitments from patients and caregivers, limiting ability to participate in social events. This distances them from family support systems that help cope with stress. Stigma of a terminal illness and cultural misbeliefs also limit full social engagement in some communities due to perceived risks, lack of understanding or pity towards the patient's situation, impacting morale. Financial challenges. Most mesothelioma patients have large medical expenses for treatments, facility stays, medications, home nursing, therapies, travel for second opinions and more. Even with insurance, high deductibles, copays and non-covered services are burdensome. Loss of income due to disability and inability to work long-term creates financial problems. Liquidating retirement savings erodes future security and leaves dependent spouse, family vulnerable. Legal matters pertaining to asbestos liability claims against responsible companies are complex, lengthy and unpredictable. Patients may spend years seeking financial compensation for past exposures and current costs. Not all claims are successful, adding more stress. High prescription drug costs for managing pain, symptoms and side effects of treatments weigh heavily. Expensive newer genomic, targeted therapies push family budgets to the limit to exhaust all treatment options. Long-term and end-of-life care needs like home hospice, palliative care, nursing home stay shift financial burdens onto families already struggling emotionally and trying to balance work, caregiving. Mesothelioma is an extremely difficult disease to face from both medical and lifestyle perspectives. Patients and their loved ones need a significant amount of emotional, physical, social and financial support from the healthcare team and community to successfully manage all these challenges with quality of life prioritized. A compassionate, multidisciplinary approach to care and coverage of treatment costs helps alleviate burdens during already difficult times.